So this research that we're doing now is really fundamental. It's quite important, and I would say it's even pioneering, because traditionally when you have research that's done at the academic level or at the scholarly level, you have the researchers and then you have the participants. Kind of research that we produce at Women at the Center here is really important, because what it does is it really it counters that idea of experts being solely academics who haven't experienced violence, but for whatever reason are the ones that are seen as the knowledge producers and the ones that are seen as the experts. Now what we're doing here is we're countering that. We're saying that no, by virtue of having experienced violence, and by virtue especially of having survived it, that we are the experts.
The reason why this research is so important and it's so exciting is that Women at the Centre has been provided an opportunity through funding from Women's College, Women's Exchange project, to get involved in an area that is really critical, and it's around strangulation. The research that we've engaged in is called A Fresh Breath, and we're looking to get the experiences of about 15 to 20 women survivors who are members of our organisation, to get their lived experiences of experiencing strangulation. And out of that, out of their experiences, we're hoping to produce two tools. One for the healthcare sector as a way to help them understand and to help them engage more and ask more women on the one hand, and then on the other hand, to another tool for women survivors themselves, to get them to understand how important an issue this is and how much of a risk factor strangulation is to other lethal violence.
Nick, I think that's really important. And when I think back on the time when I was managing the domestic violence program, the nurses started to ask survivors that were coming to the emergency department if they had been strangled, or what had happened. And 50% of the women that came through the emergency department acknowledged that they had been strangled. I know we seem to minimize this a lot in healthcare. It's hard for nurses that aren't really trained in asking the question to actually ask a woman in a way that's respectful. And I think the tools are really necessary for ensuring that the message gets out that this is really serious. And when I look at the coroner's inquest, the documents that comes out every year, they talk about depression of the neck or choking, and you just kind of wonder when are we going to really start the conversation about strangulation.
That's amazing, Shirley, and I think it's interesting that you raised the question of the healthcare worker not really being equipped with the tools of how to start that conversation and how we want to be so respectful. But I think sometimes that maybe fear of opening up that conversation stops us from maybe being able to provide the help that we need. Stats on gender-based domestic violence, 1 in 4 women likely affected, and that's changing now. We're starting to see 1 in 3 women likely to have had some sort of incident. And this research is so important, because I think getting help to women so that they can disclose and we can start to provide the support that they need, any counseling that they need, any medical intervention that they need. And we have to, as a society, start to get this out from under the carpet so we can start to end this horrible situation.